everyone. It's Dr. Brandie for another episode of Pregnancy Pain Sucks. I have a friend on the podcast who is actually my strategic assistant. We've been working together for a couple months, and in talking to her, I really wanted to pull her on the podcast because the reason she's helping me and why this is so passionate for her, I'll let you have her get into it. But I wanted the stuff that I'm hearing from her is the stuff that I hear all the time from patients, and she graciously decided to come on. So, Alyssa, can you introduce yourself and tell us why you're on this podcast?
Yeah. My name is Alyssa Roe, and I have, like Dr. Brandie had said, I've been working with her for a couple months now. I have 4 children, so I had four births and 4 pregnancies and progressive pain. Beginning.
Yeah, I told her, even this is a podcast, like it's real life. So I got my dogs, as I always do, under the desk, and Alyssa has her kids at home. We're going to talk about that too, because I think a lot of women are. I don't want to censor anything we're going to talk about, because I think a lot of women are dealing with exactly what you're dealing with.
Yeah, so. I work from home, and I have 2 young kids, and lots of that. I went from the corporate world to a much smaller job, and I don't regret it. Mm-hmm. So that is a whole nother topic we can.
Yeah, we're actually going to do 3 parts today. So there's a lot we want to talk about, and it's not because I want to drag content out, but I think Alyssa is my absolute target person that I've been working with for almost 25 years. And I think this is the stuff that people don't talk about. And I think people like Alyssa forget that they are a human being, and like they're going through a lot of stuff. So I think where she's at in life is sort of the perfect person to talk about, which is why I think it was your idea to come on the podcast and like sharing your story. And I really appreciate it, because I know it's hard to be vulnerable, but women are not having these conversations. So we're going to split this into a 3-part series, because there's so much to talk about. We could talk all day. We do talk all day. So there's 3 different parts that we wanted to highlight. One is that the physical parts and the experience Alyssa had with reporting those to OB, and how she felt and how that affected her mental health. The second part of that was mental health, about once you have this pain, how does that affect your mental health? And the third part of it that I really want to talk about is employers and trying to work as a working mom and working when you're pregnant, and sort of people treating you differently. Yeah. And not being human. While, as I said, I ran a huge business forgetting to treat women as human beings who are handling a lot and just trying to do their best. So we're going to start today. Tell me about your experience with getting pregnant for the first time, and sort of what you thought before you got pregnant, and how that first pregnancy was.
Yeah. So when I first got my first pregnancy, I was 24. So I was still very young. Me and my husband had only been married 3 months when we got pregnant. So that was a whirlwind in itself. We never lived together till we got married, and then we got married, and then we got pregnant right away. And he had just graduated college, so we were also long distance. And then during my pregnancy, he got accepted into the LA County probation
officer.
Yes.
Not probation.
Not on probation. He was a probation officer. Yes. That's why I was like, when you said that, I was like, yeah, I should probably.
I was like, let's talk after this talk about marriage. No.
So it was my physical pain. I thought, I'd never been pregnant. I was going to be, and I was going to work out during my pregnancy. I had started working out before. It was just going to be like perfect.
Yeah.
I was not going to have any problems. Only one other friend had a baby, and she never mentioned anything that was like pain or anything that, I think we were all told that it's normal. Mm-hmm. So it was just, you're going to be uncomfortable. That's just the way it is. So I remember it was probably around 19. I do have to preface that I was also like a gymnast and cheerleader, well into like my teenage years. So I thought like, oh, I have a strong core. Like, you know, I'm fine. Like I'm good. And so I started having, that's when like my sciatica started hurting, was 19 weeks. And they're like, your baby is like not even like more than a pound.
So how did you feel when they said that to you? So it's 19, so you're 5 months in on your first pregnancy. And we've talked before, like with working with me, you have access to all my stuff.
Yep.
It's really common for gymnasts, horseback riders, dancers, because they tend to be more flexible, to have a lot of the second pregnancy stuff that's really bad, like it's debilitating. So talk to me when they said, oh, it's too early, or the baby's just a pound. How did that make you feel about your being vulnerable of asking for help?
It made me feel like it was my fault. Then like I was doing something. It was my body. Because then they were like, well, you had gained X amount of pounds since your last visit a month ago. And I was like, oh, well, I'm not working out because it hurts to work out. And like it hurts. Like I said, I had an office job. So I was like, I'm hurting.
Yep.
And, it's like, well, you need to be more active. And I'm like, okay, that's hard, but I'll try. And we lived at the time like on a hill. And so we would go on walks and I would tell my husband, like, I can't imagine this is the right thing that I'm supposed to like work through the pain. I'm supposed to just, I'm a mom and this is just going to be how it is. And at the time he was also a fitness trainer. And so he had worked with a chiropractor.
Mm-hmm.
And so I went in and I seen him because of, again, no idea. Nobody referred anything to me. And he said, yes, one leg is longer, pulled the leg. That was the extent of it.
Wow.
You should be okay now.
Yeah.
And when I've been in, your stuff and looking at all the things that you provide for pelvic pain and sciatica, and I was like, I never even knew that these were options. When I've watched your videos of you working with your clients with their pelvic pain, I was like, I didn't even know that, this was even a thing. I've had 4 pregnancies. And that was the only time I've seen a chiropractor my entire pregnancy. And
so
that recommendation,
there's there's not a lot of explaining. He really probably wasn't a specialist for pregnancy. 4 out of 5 people do have a shorter leg. So that's just the way it is. It's just either because of tightness or anatomically, but just to pull your leg is not like, that's almost like comical to hear, because that's like the extent of your treatment was like pull my finger almost like
exactly.
Yeah.
I'm like, you're healed. Like what? Like, and I told my husband, I was like, well, I guess I should be fine now. Yeah. And then the more farther into my pregnancy, I started having like severe pelvic pain. And sitting really hurt, sitting during the day. So then I was also starting to miss work. Because
how did you feel with that? How did you feel? Because you feel completely fine. You're not sick, right?
Yeah.
Your doctor's telling you that like you're over exaggerating having this pain. You live with a fitness trainer, which I know because my ex-husband was an Ironman, that you're like gaining all this weight and you feel like absolute shit about yourself. And then you go to the doctor, they're making you feel like shit. You're trying to get help and you're going to like a wacky chiropractor who pulls your leg and doesn't really explain things. So like it just, talk to me about how you felt. Like, did you feel like, what the fuck? Like,
I felt very
alone in this, and you're just sort of like, you have to deal with that in your head. Talk to me about that, of like your mental health, about not being seen or heard or understood.
Yeah, mentally it was like mind games, because I felt gaslit by everybody, including myself. Where it was, from the OB, it was, well, you're gaining too much weight. And I was like, well, I'm not, yes, I'm probably not eating the best. But what should I be eating? Like, you know, I didn't understand. I should be working out, but it hurts to work out. And even to lift anything was like to bend over and lift anything, I could feel it in my pelvic. I could feel it up my back, in my lower back. I got carpal tunnel.
Did you talk to your friends about it? Were you able to talk about your pubic? Because I think a lot of women are afraid to, they're like close with their friends, right? But at the same time, they're not that close. Like you and I have conversations all the time because like, I do this and it doesn't phase me. But like, could you say to your friend, man, my lady town is really hurting? Like,
no,
you say that I'm laughing. Like, it's so effed up. Like, even I find myself, you make a joke about someone's pain, but it's not, I'm sorry.
No, but yeah.
Like, you're just like, because this country is so uncomfortable to talk about anything with your pubic region. So like talk to your friends, like you might get teased of like, like all that kind of stuff. And it's embarrassing to bring up your private parts.
Yeah.
Never hurt like that. And
yeah.
It's a mind screw. Like it really is. That's what I'm saying. Like even my was doing this for 25 years, there's aspects that I still catch myself. I'm like, what the hell am I doing? Like, because it's so uncomfortable to talk about. Talk to me about like, could you talk to your friend? Did you go back to your friend that was pregnant and be like, dude, what the hell? Why didn't you tell me?
No, I didn't. I never said anything to anybody. She never complained. So I thought it truly was just me, that it was just my body. It was just how I was responding to pregnancy. Once I have her, it'll be fine. And then they had said, oh, she's a really big baby. And you're very small. I'm only 5'2". And so my husband's 6'2". And so I thought, oh my gosh, I am making a D1 athlete in this little womb of mine. And she's going to come out like massive. And that's just, I'm going to feel so much better. And so I just kept thinking that like, this is, what do they say? Like, it's worth it. It's worth it. All this pain, all of this suffering for your pregnancy, when you meet the baby, it's worth it. And I did not feel that. So my water broke, and it was great. And I went to the hospital, and I was in so much pain I couldn't like really walk. Besides contractions, just like my pelvic pain, I was like, she's falling out. And they're like, you're a 2. And I'm like, well, something's falling out of me.
Like, saying, hey, I hear you. This is really sucky right now, but like, let me just tell you where you're at. Like, there's a nicer way to put that instead of gaslighting you.
Yes. And they wanted to send me home.
Yeah.
They were like, I was like, my water broke. Like, you hear all these things. Like, if your water breaks, you go straight to the hospital. And I had, at that point, I was losing so much blood. Like, I would get up to use the restroom in triage, and my husband was having to, like, wipe up from, like, my bed to the restroom.
Wow. That's scary.
Yes, that was very scary. That was, like, my husband was like, I'm absolutely not taking her home. We live a half hour from this hospital. I don't care if we have to sit in the waiting room and she bleeds there, but we're not leaving this hospital.
I love your husband for that. Yeah. Like, sometimes you need a strong partner to step in and be like, absolutely not. Yeah.
He was like, I'm not taking her home like
I would not mess with somebody on probation. No, joking. Or probation officer, either one.
And he was in the academy, and it was like they had, like, he could not miss the academy. Yeah. So I went in, it was in the middle of the night, or no, it was late at night, and so he left. He had to go to the academy 5 o'clock in the morning. So my mom came to be with me during labor, and she got stuck in my pelvic. Like, I guess it would be in my pelvic region, and I could feel her. like she was wanting to come down. Obviously, now I know what that is. I didn't know what that was at the time. And the only thing they did was give me a button for more epidural. And I hit that thing like I was
No,
being addict. Like I had never felt better. I was like out.
it feels so good when your legs are that numb. I was like offering favors. I worked in the PACU and I'm like offering favors because it feels like when you're drunk and your legs are just like nice.
Yes, it just you feel wonderful. I'm like I could do this a million times.
Yeah.
And so
What were you doing for a job before you had? So you had pubic pain, you had low back pain, you had sciatica. What were you doing for like? What was 40 hours of your week? How did you spend that?
Yeah, I was an admin assistant at the time. So I worked in a construction. So I sat at a desk
all day.
Pretty much 7 hours a day, other than when I was on lunch and maybe walking back and forth to the site.
Yeah.
It wasn't
active. Yeah.
It wasn't an active job. And then to go home and just hurt so much that I just wanted to lay down because that was the only relief that I felt.
Yep.
And they told me to put a heating pad on it like you have cramps, but don't leave it on too long because you could hurt your baby. And I was like, okay, well then I'm not doing it at all.
What do you know about heat now after working with me for a couple of months?
To not use it, to use ice.
Yeah.
Yeah.
You brought more blood into an already pissed off area. So not good advice sometimes. Yeah.
Exactly. And so nobody ever said ice. Yeah. Ice yourself. Nobody ever.
Physical, though. It does sound like you want me to put ice where?
Yeah. I would have also been like, I'm not sure about that, Liz.
Yeah.
I'm gonna pass on that advice.
I'm gonna give the popsicles to my husband.
Yeah. Yeah. Don't open the popsicle. But so sitting there all day, I was in excruciating.
Your body wasn't ready.
It wasn't ready.
It's so physical to have a baby. Like it's physically that your pelvis has to expand, and you're stiff as hell.
Yeah.
The premises of what we do, you and I and Heather and the team does, is so important to educate people that they need, unless they're high risk, you have to try to move. And I know I've had the debilitating exhaustion where you feel like I just want to like lay on the couch and just watch Hallmark movies, but you have to be able to move. So end up what was with the subsequent pregnancies as you had more babies? Did the experience get better?
No. My experience got worse. After I had her, they had said, your pelvic was so small. Mind you, she was only 7 pounds.
She was huge. You are little. You're tiny.
She was not a huge
baby. They scared the shit out of you.
Yes. So then I thought to myself, why was I in so much pain if she wasn't a huge baby?
Yeah.
And my doctor said, well, I guess it was just all you. And I thought,
F that dude.
I was like, okay.
Like, what a thing to say to you after you just and you had some medical complications too that we're not going to get into, but you had some medical complications. And it's just like, I don't get it.
Yeah.
I don't, you're a new mom. This is a new role for you. And instead of empowering you or building you up or reassuring you, they blame you.
Yeah. And it lasted forever. It lasted. And nobody, once I went back for my 6 weeks checkup, I was still hurting. Mm-hmm. And nobody was like, maybe see pelvic floor physical therapist. I didn't even know that was a thing. I had no idea that somebody actually did that for, that was a true occupation.
Yes.
Yes.
Yeah.
And so then I got pregnant with my second one. I think my oldest was a little over 1.5 years. She was almost 2.
Which is so common. That's how a lot of women, they want to have all their babies in a row. Mine are 9 years apart because my person was so miserable. I didn't want to do that again for a bit. And so
I didn't ever want to have more children.
Yeah, it's scary.
Yeah.
Why would you, can you tell me anybody besides your husband, who was a supportive force for you? Was anybody safe for you that really made you feel like you were seen?
Um, yeah, I feel like my mom, but it was, and I had, I would talk about my experience with people, like with other pregnant women, because then at that time it was like everybody was having babies.
Yeah.
My sister-in-law and my husband's cousin had had a baby before me, but nobody felt, it was
Terrible.
like, it was like nothing.
What am I doing wrong?
Yeah, I'm like, what am I, like, what is wrong with
I
my
want it to
body?
go well. Like this is your one shot.
Yes.
Yeah.
And um so when I would talk to them, they'd be like, "Oh, I didn't have that." I mean, I had a natural birth. I guess I had natural, but I had a natural birth, and I was in the hospital for 4 days,
Wow.
and it was just like it. All of the experience with my first, from physical, pregnancy mental, birth, labor, mental and physical, and then after,
Yeah.
postpartum was just all enough to make me like want to sew myself up and like never doing this again.
Yeah. Yeah.
And
Because you want kids.
yes,
Yeah.
because
Yeah.
I wanted to have 4 kids.
Babies when they're on the outside, but like carrying them was a different story. And
Yeah, I'm like, I don't want to do this again.
yeah, it feels
Yeah.
bad to say that because a lot of women can't get pregnant, and
Yes, and then you
they're like,
feel guilty.
yeah, they're like, just be grateful that you got pregnant, and you should be happy with it.
Yeah.
But it
Yeah.
sucks. Hence,
Yeah.
pregnancy being sucks. So we're gonna wrap this up for this section. But you have expressed a lot of times that this is a mission for you with working with me.
Yeah.
Um, what would you tell your former self or somebody that's out there that is pregnant right now and had the same experience? I'm telling you, like so many millions of women did. What would you say to her that she would know that you see her and that you could help her a little bit with your wisdom?
I would say advocate for yourself, research, don't take it for face value of this is normal. You'll feel better after you have the baby. It goes away as soon as, because it doesn't. And it's, my first is almost 12 years old. Am I, you know, I still hurt. Certain activity still is not super comfortable. Certain exercises I can't do because it hurts my. But sometimes it feels like something is going to fall out of me to this day, and my youngest is 2. So, I gave my body like,
Yeah, that's a big
yeah,
thing to say is it does not go away. So a lot of people they'll say when you're helping me with my courses and stuff, when we get feedback from customers, they're like, "I'll just wait till the end. I'll just wait till it's over. It'll go away." I'm telling you, as somebody who's been in practice for almost 25 years, and we've joked about this because
yeah,
I love this so much that I never expected. Is I'm taking care of women now that I took care of in their pregnancies
yep,
20 something years ago, and we all got divorced. Um, and I'm married now, but we were dating again. And a lot of these women are having their pubic pain come back, which sounds like because the stuff's still in there. The trash, the adhesions, the gristle, I sort of say to speak, the knots, it's not going to go away. So, like Alyssa's saying, anytime you go to work out, it's not like poof, it never happened.
it's just, yeah,
The damage is there. It can be the quicker you get on that and work through it, it will cause low back pain if you don't get this fixed, if you don't do pelvic floor therapy. So we're out here saying to you guys, this is important. You are important because we're going to talk about the next section of podcast number 2 with Alyssa is the mental aspect of it, of what she just said. If you can't put yourself in her spot of that, that's why I'm so passionate about what I do because it's 2026 and I still see women who come in and they have their face is just like I'm doing something wrong. I am apparently like I'm not doing this right because no one's giving them solid guidance of how it really is, not to scare them, but to reassure them that they're not alone. There are things that can be done. So if you're feeling like this right now, please know that Alyssa's story is so stereotypical. That's what she probably felt alone until you work with me and you can't talk about this stuff because it's like, oh, get over it. Or like, you
normal. It's,
carries this with her the rest of her freaking life. And if we can stop you from going down that dark path of feeling like it's your fault, we want to let you know it's not. So we're here for you. And we're going to wrap this up. This is the first episode in terms of this series, Pregnancy Pain Sucks with Alyssa. And we're going to get into part 2 next week. Tune in for the mental health component with Alyssa on Pregnancy Pain Sucks.